Personality disorder. Psychopathology. Personality disorder, PD, is defined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-4 as an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, leads to distress or impairment in interpersonal and social functioning. PD is often accompanied by a history of being abused or having behavioral disturbances during childhood. There are different types of PD. Type A, paranoid, schizoid and schizotypal. Often appear odd or eccentric. Type B, antisocial, borderline, histrionic and narcissistic. Often appear dramatic, emotional, and erratic. Type C, avoidant, dependent and obsessive-compulsive. Often appear anxious or fearful. Epidemiology. Prevalence ranges between 2 and 13% in the general population. There are gender differences. Antisocial PD is diagnosed more frequently in men. Histrionic, borderline and dependent PDS are diagnosed more frequently in women. Clinical presentation. The diagnosis needs a longitudinal view of a person's lifelong behavior patterns. Difficult and odd behavior in reaction to a stressful situation can easily be confused with a PD. NB. Factors that must always be assessed in PD. Deliberate self-harm, aggression, violence, impulsivity, suicide. Comorbid mental illness is frequently present, e.g. depression, drug dependence, alcohol dependence and anxiety disorders. Treatment. Psychotherapy remains the mainstay of treatment. The success rate of patients recovering sufficiently to no longer meet the diagnostic criteria for PD can be as high as 52%. Types of psychotherapy used include psychodynamic therapy, cognitive behavior therapy, interpersonal therapy, dialectic therapy, group therapy. Certain PDS tend to be resistant to treatment, e.g. antisocial PD. Drug treatments are only occasionally effective in reducing problematic behaviors and should be prescribed in a specialist setting only. The following have been found to have some limited efficacy. Antipsychotics and selective serotonin reuptake inhibitors at low doses for impulsive, deliberate self-harm behavior. Carbamazepine for aggressive behavior. NB. Drug treatments can be effective when they are used to treat a comorbid illness, e.g. treat depression and problem behaviors may abate. Prognosis. The course of PD is variable, but as a general rule it ameliorates with age and may even remit.